Hello students. Today we will going to discuss about the introduction of hospital and clinical pharmacy. Under that we will going to see the importance of this subject and significance of this hospital and clinical pharmacy subject in diploma in pharmacy. First of all, the question arises in my mind is that why this particular subject is included in D-Pharm curriculum. So, because we are the pharmacist and we play the role in the healthcare system. So ultimately, we must have to be aware about the hospital organization, either by government or by the non-governmental hospital organization. So first of all, need to understand this. Then next, we need to understand about the hospital pharmaceutical services. Under that hospital pharmaceutical services, what are the different services comes under that, right? So we need to distribute the drug, we need to inpatient and outpatient services, everything comes under that hospital pharmaceutical services. So this is our second priority, to understand the hospital pharmaceutical services as a pharmacist. Then to analyze the clinical pharmacy practices. What exactly the clinical pharmacy and what is the clinical pharmacy practice, that we need to understand, to get aware about that, and we need to implement that. So for that purpose, this particular subject is included in D-Pharm curriculum. Now the different role of pharmacist in hospital. So first of all, inpatient services includes types of services, detailed discussion of unit dose system. We know that pharmacists are involved in the drug distribution, compounding of that particular drug, whichever is prescribed by the registered medical practitioner. As well as we need to have the proper services once the patient is admitted into that of the hospitals. And we need to see all the drug therapy. We need to involve in the discussion of drug therapy for that particular patient. So this is our inpatient services. Then we know that in every hospital there is a one OPD, that is outpatient department, and in that also our pharmacist having the major role. So drug distribution system in hospital, because there where we were already seen that, or many times we are already when we enter into that of the government hospitals, civil hospitals, non-government hospitals, there will be the first of all the OPD. We have to go to the OPD, then the doctor will see our patient, our condition or patient's conditions. They monitor that patient, and then after checking they decided that either this patient required outpatient services or inpatient services. That we need to understand. Now let us see the another role of pharmacist in hospital. First of all, for PTC, pharmacist therapeutic committee, they play their role to formulate the hospital formulary. That means all the medical staff, including physician, pharmacist, they discuss with each other and see the need of different kinds of the drug for the hospital, so that that particular drug will be formulated effectively with very low cost, so that the patient can take the advantage and easy availability of that particular drug or a medicine. Then the last or very important role of pharmacist in hospital is the drug information services. Pharmacist is always updated about the drug information, drug launching, new drug come into the existence for treating the different diseases and disorder. So they need to have a drug information services like journals, magazines, likewise. Now next role of pharmacist in hospital is to understand the surgical dressing theoretically as well as practically. We need to check out the quality of surgical dressing and what purpose it is to be utilized in the hospital. So that everything in details we will going to see, and that is the major role of pharmacist in the hospital. Another is to computer applications. Applications of computer means to manage the all inventory controls and drug distribution in centralized manner. We can manage it with the help of the computers, PC, so that the easy availability of the data and the inventory, means whatever the drug required in the hospitals, and they can easily bring it, easily purchase it, and what is the daily routine of the distribution of the drug related to that hospitals, so they can understand the patient's viability with respect to diseases and disorder and the drug therapy required for that. So they plays a very important role, that is application of computer. So the pharmacists need to maintain in the hospital through the computers. Now let us see the very important aspect of this subject, that is clinical pharmacy. Clinical pharmacy, here the pharmacist is to taken care of the patient and monitor the drug therapy with respect to the health and clinical condition of the patient. Let us see the different role as a clinical pharmacist. So first of all, the pharmacist need to do the patient counseling in a very effective manner. For that purpose, we need to take a training, and that is into this particular diploma in pharmacy, how to counsel the patient. Through that counseling, the patient take a right medication at right time. Then diseases and pathophysiology. Yes, clinical pharmacists must have to be known about the different diseases and their pathophysiology, their pathophysiological condition, clinical condition of the patient. According to that, they can involve in the discussion of the patient therapy and which drug is suitable for that particular patient. They can have a proper suggestion to the medical team. Then adverse drug reaction. Clinical pharmacy must have to be know about the ADR of that any of the drug medication which is available for that particular diseases and disorder, and their adverse drug reaction, their side effects. Then drug interaction and dependence. Pharmacists must have to be knowledge about that, which drug is interact with that of the drug-drug interaction, like or a drug internal any of the chemicals supposed to say that they get interact with that. So they must have to be have the particular knowledge of the drug. Either they get interact with drug-drug interaction, or they get having the any of the allergic conditions. So ultimately they must have to be knowledge about that, the drug interaction and drug dependence. Next role is to bioavailability, because maximum amount of the drug that reaches to that of the systemic circulation when they taken by the oral, when they taken by the any of the different routes of administration, and maximum amount of the drug is to be available, and that bioavailability, what in which drug, different medications having their own different bioavailability, either in the solid dosage form, parenteral dosage form. So the pharmacist, clinical pharmacist must have to be their knowledge, and ultimately there is having the role to provide the proper dosage to the patient through the patient counseling, and if then and then only they can counsel in the patient in a very well manner if they are very well aware about the disease and pathophysiology, ADR, drug interaction, drug dependence and bioavailability. So thank you very much for your patience hearing, and I thought what is the importance of that, what is the significance and the introduction of hospital and clinical pharmacy, you have well understood whatever the parameters we were discussed over here, and this is just an introduction. Now hereafter we will go one by one the different topics which is included into that of this particular subject. So thank you once again.